Hi, good morning. We're here in Barcelona. I'm Karine Tawagi. I'm a genitourinary medical oncologist at the University of Illinois in Chicago, and also the co-host of the podcast Two Onc Docs. And I'm excited to be here with Dr. Necchi from San Raffaele Hospital to talk to us about some of his studies, which he'll be presenting here at ESMO. And so, Dr. Necchi, first I wanted to ask you, for one of the sessions that you're going to be talking about tomorrow, what are some challenges that currently exist in the treatment of penile cancer?
Yeah, thank you. Thank you for the invitation. Well, penile cancer is a rare disease, it's a rare tumor. So the limitations in the management of this disease, as well as investigation in new therapies, are the typical limitations of rare tumors or orphan disease. So basically, we have multiple limitations in the multiple ways of further research in this disease, primarily represented by the management or the search for newer options and newer therapeutic options in patients with locally advanced disease or metastatic disease. So we are limited in the way we treat patients with regards to chemotherapy. Most of the patients are not fit for cisplatin chemotherapy, and the results of perioperative chemotherapy, adjuvant or neoadjuvant chemotherapy prior to lymph node dissection are still suboptimal. So we need to invest more on this disease. And another point is, a very important point, is the identification of new biomarkers for patient selection and the identification of new therapeutic pathways. And in this regard, human papillomavirus infection, HPV infection, is currently defining a population of the patient, a very distinct patient population that may be well suited for different approaches other than chemotherapy, and in particular the role of immune therapy seems to be quite promising in this select patient population, based on the fact that usually HPV positive tumor, HPV positive penile cancer, are also characterized by features that may portend response to immunotherapy, like higher TMB features or PD-L1 expression. So an opportunity for immune therapy, as it is also suggested by the preliminary results from trials that have been published or presented today.
Absolutely. That's definitely a great point, that we need better biomarkers. And I know there was some data presented at ASCO with regards to immunotherapy with platinum-based chemotherapy in advanced penile cancer. And including that trial, what are some of the results that you're excited about in terms of the future of penile cancer treatment?
Well, the Brazilian colleagues presented, as you mentioned, in the ASCO last year, an international huge effort, an Herculean effort. The trial is called HERCULES trial. There was a trial investigating the combination of pembrolizumab with standard chemotherapy, platinum 5-FU, in patients with locally advanced or metastatic penile cancer. The results in terms of objective responses were quite promising. Survival data are still immature, but in particular, as suggested by the authors, there was an enrichment in the responses in the HPV positive tumor, TMB high tumors. So this could be a potential strategy to enrich and to validate in further studies. Next generation trials, for sure, should aim to move in two different directions. In selecting patients with more focused disease, more selected disease, for example, HPV positive tumor for immune therapy, and on the other side, looking at penile cancer when considering basket trial testing newer therapies. So penile cancer population and penile cancer patients with advanced disease are well suited for basket trial testing newer agents in phase 1.
Right, and that's definitely the case for a lot of rare GU cancers, perhaps, to do these basket trials. And I think I agree, it was exciting to see the results of HERCULES and having response rates, around 39%. And I'll be looking forward to seeing more of the survival data. And I think the trial should also be applauded for the diversity of enrollment on that trial compared to other historic trials that we've seen in this space. Yeah,
penile cancer is very frequent in particular areas like South America, and in Brazil is quite frequent, or India. This means that we also have to concentrate and differentiate our efforts as compared to other more frequent tumors, including and coagulating people and colleagues and investigators from these geographical areas to invest on multi-center studies.
Yeah, absolutely.